Worldwide this morning, growing concern over a growing health crisis, with health officials here in the U.S. moving fast to prepare for what the CDC has called an inevitable spread.
We are right now in a very active containment mode.
Thousands of Americans nationwide already under voluntary self-quarantine after returning from China, even though they don't pose any immediate risk. The U.S. has faced outbreaks before. From SARS in 2003, which killed at least 774 globally, to the H1N1 virus in 2009, which had an estimated global death toll of at least 151,000. Both outbreaks providing the government a roadmap as it navigates the days and months ahead. At Northwestern Memorial Hospital in Chicago, Dr. Benjamin Singer says they're on alert for coronavirus, even as the ER and ICU are filled with patients recovering from the seasonal flu. How do you distinguish between coronavirus and the typical flu?
It can be a challenge when a patient first presents for care because the symptoms overlap quite a bit. And that's why we pay a lot of attention to their history, where they've traveled, and the people with whom they've been in contact.
Meanwhile, as health screenings continue at select U.S. airports, the CDC is distributing new test kits to public health labs nationwide as early as next week, ensuring there are enough supplies on hand, including surgical masks and gowns. First responders now training to identify possible cases. In Pittsburgh, they've been given personal protection kits. Health experts, though, insist an outbreak will look nothing like what's been depicted in Hollywood movies.
When did we run out of body bags?
Like Contagion in 2011.
It will look and feel to the American people more like a severe flu season in terms of the interventions and approaches you see.
President Trump says he'll do whatever is necessary, even if that means following China's lead and quarantining entire cities.
We do have plans on a larger scale if we need it. We don't think we're going to need it, but, you always have to be prepared.
Prepared to take every precaution while facing a new and unfamiliar disease.
Look down. And Tom, even on the way down here, flying down here, a couple of people had those face masks on, so it got me wondering, and a lot of folks wondering, are they a good idea? Do they do anything?
Yeah, so I asked Dr. Singer here at Northwestern that very question, and he referred me to the CDC guidance, which says if you are sick or if somebody in your family is sick, then this makes a good idea, right? Because you want to avoid spreading the germs. It's less effective if you're simply trying to avoid getting sick by going through an airport or a bus station or whatever else. This may not be that helpful. What is helpful is to constantly wash your hands, don't touch your face, and if you're in a clinical environment, take advantage of the hand sanitizer. All of us here in the ER have been doing this constantly, both yesterday and today.
You mentioned the CDC, Tom. There's news this morning that they're changing their criteria for testing patients after that first case of unknown origin in the U.S. was confirmed. What more can you tell us about that?
Yeah, and this is critical, right? Because up until now, they were separating these cases out by the travel history. But now, if this disease is spreading on its own in the United States, that no longer is enough. So they're now going to be pushing 93 test kits to labs across the country by this weekend so that there will be a quicker way to diagnose somebody with coronavirus. Meanwhile, 70 companies are competing with finding some sort of a diagnostic test for hospitals to use at the bedside so that you don't have to necessarily send those out to a lab. But absolutely, the whole spectrum here is opening up if this is now out among the population as opposed to a simple travel history alone.